Many individuals live with serious health conditions, often unknowingly. Unmanaged, these conditions can lead to severe and life-threatening complications. Recognizing subtle initial indicators is crucial for timely medical intervention. This segment explores the often overlooked early warning signs of diabetes. Understanding these signs promotes proactive health awareness and early diagnosis. Diabetes is a chronic metabolic disorder characterized by persistently high blood sugar levels. This condition arises from either insufficient insulin production by the body. Alternatively, it can occur when the body cannot effectively utilize the insulin it produces. Insulin is a crucial hormone produced by the pancreas, essential for glucose regulation. Its primary role is to facilitate the absorption of glucose from the bloodstream into cells. Once inside cells, glucose is converted into energy, powering various bodily functions. In a healthy individual, the pancreas, an organ located behind the stomach, plays a vital role. The pancreas is responsible for producing insulin, a crucial hormone. Insulin functions as a key, enabling cells to absorb glucose from the bloodstream. This glucose, derived from food, enters the cells to provide essential energy. When this intricate process of insulin production and glucose uptake is disrupted, complications arise. Consequently, glucose accumulates in the bloodstream, leading to elevated blood sugar levels. After food intake, carbohydrates are broken down into glucose, a primary energy source. This glucose then enters the bloodstream, elevating blood sugar levels. Insulin facilitates the transport of glucose from the blood into various body cells. Cells, including muscle and fat cells, then use or store this glucose for future energy needs. Type 1 diabetes is an autoimmune condition affecting the body's ability to produce insulin. The immune system mistakenly targets and destroys beta cells in the pancreas. These beta cells are responsible for producing insulin, a vital hormone. This destruction leads to little to no insulin production within the body. Consequently, individuals with type 1 diabetes require external insulin for survival. Type 2 diabetes is the most common form of diabetes, affecting millions worldwide. It develops when the body's cells become resistant to insulin, a hormone produced by the pancreas. Alternatively, the pancreas may gradually lose its ability to produce sufficient insulin. This insulin resistance prevents cells from effectively absorbing glucose from the bloodstream. Consequently, blood glucose levels become elevated, leading to various health complications. Genetic predisposition is a major cause of diabetes development. A family history of diabetes, especially type 2, increases an individual's risk. This indicates a significant hereditary component, influencing disease susceptibility. Genetic factors play a crucial role in determining an individual's likelihood of developing diabetes. Obesity is a primary risk factor for the development of type 2 diabetes. Excess body fat, particularly around the abdomen, is a key contributor to this risk. This excess fat can lead to a condition known as insulin resistance. In insulin resistance, the body's cells fail to respond adequately to insulin. This forces the pancreas to produce more insulin to compensate for the cellular unresponsiveness. Over time, this increased workload can exhaust the pancreas, leading to impaired insulin production. A sedentary lifestyle is characterized by a significant lack of regular physical activity. This inactivity is a major contributor to the development of insulin resistance within the body. It also plays a crucial role in promoting unhealthy weight gain. Conversely, regular exercise enhances cellular sensitivity to insulin. This improved sensitivity facilitates glucose uptake, thereby reducing the risk of diabetes. Diets rich in processed foods, sugary drinks, and unhealthy fats negatively impact health. These dietary patterns are significant contributors to weight gain. Such diets also promote the development of insulin resistance in the body. Frequent consumption places continuous strain on the pancreas, an essential organ. This persistent strain can lead to chronically high blood glucose levels over time. Increased thirst, known medically as polydipsia, is a common early warning sign of certain conditions. When blood sugar levels become elevated, the kidneys work harder to filter excess glucose from the blood. This increased renal activity leads to a higher volume of urine production and frequent urination. The excessive fluid loss through urination results in dehydration within the body. Dehydration then triggers an intense sensation of thirst, prompting increased fluid intake. Frequent urination, or polyuria, is a significant medical indicator, often more noticeable at night. This condition arises when the body attempts to eliminate excess glucose present in the bloodstream. The kidneys play a crucial role by trying to excrete this surplus glucose through urine. To facilitate glucose excretion, the kidneys draw additional water from the body into the urine. This process results in a continuous and substantial loss of bodily fluids. Consequently, individuals experience an increased frequency and volume of urination. Unexplained weight loss can occur despite regular eating, particularly in undiagnosed diabetes. In diabetes, the body struggles to effectively utilize glucose, its primary energy source. This inefficiency means glucose cannot properly enter cells to provide necessary fuel. Consequently, the body seeks alternative energy sources to sustain its functions. It begins breaking down muscle and fat tissues to convert them into usable energy. This metabolic process ultimately leads to a noticeable and often significant reduction in body mass. Persistent and increased hunger, medically termed polyphagia, can be a significant indicator of diabetes. In diabetic individuals, the body's cells do not receive adequate glucose for energy, even after food intake. This cellular energy deficit occurs despite sufficient glucose levels in the bloodstream. The body interprets this lack of cellular energy as a need for more fuel, triggering continuous hunger. Thus, polyphagia reflects the body's attempt to compensate for inefficient glucose utilization by its cells. Elevated blood sugar levels can impact the body in various ways, including ocular health. Specifically, high glucose concentrations affect the delicate small blood vessels within the eyes. This impact leads to a shift in fluid balance, causing fluid to move into and out of the eye's lenses. Such fluid movement temporarily alters the shape and curvature of the natural lens. The change in lens shape directly interferes with its ability to focus light correctly onto the retina. Consequently, individuals may experience blurred vision that can fluctuate throughout the day. Diabetes is a chronic condition that can significantly impact the body's healing processes. One major complication is impaired circulation, reducing blood flow to extremities. Additionally, diabetes can damage nerves, leading to diminished sensation and awareness of injuries. These factors collectively hinder the body's ability to efficiently repair wounds. Consequently, cuts, sores, or bruises may take an unusually long time to heal. Such slow-healing wounds serve as a critical warning sign and elevate the risk of infection. Individuals with diabetes exhibit increased susceptibility to various infections. Common infections include yeast infections, urinary tract infections, and skin infections. This heightened risk is directly linked to elevated glucose levels within the body. High glucose creates an environment conducive to the proliferation of bacteria and fungi. Such conditions allow these microorganisms to thrive and multiply more readily. Chronic fatigue and general weakness are common physiological symptoms. These conditions often arise when the body's cells are deprived of sufficient glucose. Glucose is the primary energy source required for cellular function and metabolic processes. Without adequate glucose, cells cannot produce the energy needed to perform their functions. This energy deficit leads to persistent tiredness, even after periods of adequate rest. Consequently, individuals experience a general lack of stamina and reduced physical capacity. Neuropathy, or nerve damage, often manifests as tingling, numbness, or pain. These sensations typically occur in the extremities, such as the hands and feet. Elevated blood sugar levels are a common cause, damaging nerve fibers over time. This damage impairs nerve signal transmission, leading to these distinct sensations. Adopting a balanced diet is crucial for reducing the risk of developing diabetes. This includes incorporating a rich intake of whole grains into daily meals. Lean proteins are also essential components of a diabetes preventative diet. A high consumption of fruits and vegetables further contributes to risk reduction. Limiting processed foods, sugary drinks, and saturated fats is vital. These dietary choices help maintain stable blood sugar levels and a healthy body weight. Regular physical activity is crucial for maintaining overall health and well-being. It is recommended to engage in at least 150 minutes of moderate intensity aerobic activity per week. This should be complemented by muscle-strengthening exercises to maximize health benefits. One significant benefit is the improvement of insulin sensitivity within the body. Enhanced insulin sensitivity allows the body to utilize glucose more efficiently. Consequently, regular exercise aids in effective weight management and metabolic health. Maintaining a healthy body weight is crucial for preventing the onset of diabetes. Even a modest reduction in body weight can significantly improve health outcomes. Weight loss enhances insulin sensitivity, allowing the body to use insulin more effectively. This improved sensitivity directly reduces the risk of developing type 2 diabetes. These benefits are particularly pronounced for individuals classified as overweight or obese. Regular medical checkups are crucial for maintaining overall health and well-being. These checkups include vital screenings, such as blood glucose tests. Such screenings facilitate the early detection of potential health issues, like diabetes. Early diagnosis enables timely medical intervention and effective disease management. This proactive approach can prevent or delay severe complications associated with chronic conditions. Diabetes management integrates lifestyle changes with potential medication to control blood glucose levels. Lifestyle modifications are crucial, including dietary adjustments and regular physical exercise. Medication may include insulin therapy or oral hypoglycemic agents, depending on the patient's needs. The specific treatment plan is tailored based on the type and severity of diabetes. All management strategies are developed and guided by healthcare professionals for optimal patient care. This video is intended solely for educational purposes. It should not be considered a substitute for professional medical advice. Always consult a qualified healthcare professional for health concerns. Seek advice before making any decisions related to your medical care.